Okay, our topic for today is histology of heart and blood vessels. Okay, we all know that heart has four chambers, namely your right atrium, your left atrium, your uh, left and right ventricle. Okay, so unoxygenated blood or blood coming from different organs will go to the heart via the right atrium. No? And the left atrium will be the one, the blood coming from the left atrium is oxygenated blood supplying the different organ systems. Okay? This is the superior vena cava, that is the blood vessel, the vein, goes to the right atrium, and the different uh, pathways, conducting pathways, starting from the SA node, that's the pacemaker of the heart, goes to your AV node, distributing its electrical impulses to this one, the AV bundle or the atrioventricular bundle or the bundle of His. Of course, supplying the electrical impulses, the right bundle, left bundle, and the Purkinje fibers. Okay. All right. So let's start with the walls of the heart. We have three. You have the endocardium, the myocardium, and the epicardium. Myocardium is the thickest layer or thickest wall of the heart. But let's start with the endocardium first. The endocardium covers the inner surface of the atrium and the ventricles, and they are aligned, if it is inner surface, they are aligned by your endothelium or endothelial cells. When we say endothelium, it is a simple squamous epithelium. Okay? They are also continuous with the blood vessels. So, asan ang endocardium? Here. If you notice, this is the endocardium. And there is this layer called your subendocardium layer. Okay? This is part of the endocardium layer, but this is your subendocardium. Your subendocardium is the thin layer of loose connective tissue which is made up of a collagenous or elastic fibers. So both collagen and elastic fibers are present in the subendocardium. What else? There are also blood vessels and nerves. It serves as a conducting portion. So when you say conducting portion, ba't kaya conducting portion? Meron ditong structure na sa subendocardium lang makikita. Okay? And also, it binds endocardium to myocardium. Look at this picture, class. So if this is the endocardium, this is the subendocardium. Immediately after the subendocardium is the myocardium, which is the thickest layer of the heart. So what does it do? The subendocardium binds the endocardium to myocardium. As I mentioned, there is this conducting portion of the heart, and this is what we call your Purkinje fibers, which is only found at the subendocardium. Okay, please take note, they are not found at the endocardium. When I say Purkinje fibers, they are found at the subendocardium. What are these Purkinje fibers? They are modified cardiac muscle cells that are located in the AV bundle or the atrioventricular bundle and its branches. So para siyang cardiac muscle cell na minodify. What are its characteristics? Reduced lang ang number of myofibrils, Purkinje fibers. There are more sarcoplasm and they have abundant glycogen. They have larger in diameter and they lack transverse tubules of the cardiac muscle. But when I ask you in the practical or in the theoretical exam, what is the function of the Purkinje fibers? You answer conducting system of the heart. Okay? Yan. So, asan dyan ang Purkinje fibers? I will show you in a while. Okay? Basta nasa subendocardium lang siya. Better ang picture sa laboratory. So, later at the laboratory, I'll show you where are the Purkinje fibers. Okay, the main mass of the heart, the thickest portion of the heart is the myocardium, and the cardiac muscles are arranged in bundles or fascicles. They have strands of connective tissues and vascular network in between the cells. So basically, this myocardium is comprised of obviously cardiac muscle cells. And as a review, cardiac muscle cells are striated, they are involuntary, their shape is cylindrical with branching ends. What is the number of nucleus of the cardiac muscle cells or cardiac myocytes? They are mononucleated or binucleated. They have centrally located nucleus and they are what is its characteristic appearance or structure is the intercalated disc. No, that is your myocardium. Now this is a picture showing you the characteristic cardiac muscle cells. So they are elongated with branching ends, no? Na-mention natin to. This is its fiber, no? Nagba-branch out pa siya. Not unlike your skeletal muscle, they have blunt ends. While your cardiac muscle cells, they have branching ends. Okay? In between these fibers are your blood vessels. These are your capillaries. Okay, not a perfect picture for for this cardiac muscle. The one that is encircled is actually an intercalated disc. But as I've shown you in the prelims, no, may mga pictures tayo na ipapakita na kitang-kita mo pala it's cardiac muscle cell because of its intercalated disc. No? But in the practical, this is not the picture that I will be showing you. It is at the laboratory. Alright, and last layer is the visceral layer of the pericardium, which is your epicardium. They're also lined by a single layer of flat or cuboidal mesothelial cells. And if the endocardium has subendocardium, your epicardium also has subepicardium, which has a thin layer of connective tissue. It also contains elastic fibers, blood vessels, and nerves. Okay. Okay, this is just to show you the epicardium, which is contains your fat cells, your connective tissue, and the nerves of your heart. That is your epicardium. So there is this pericardial cavity. This is the space between the epicardium and the parietal pericardium. So class, itong pericardial cavity, dapat yung space na to walang fluid. Okay? Kung may fluid man, this is your serous fluid that is secreted by your mesothelial cells. And that layer, that pericardial cavity, that the layer between epicardium and parietal layer should glide freely. Okay? Kaya nagkakaroon ng congestive heart failure or nahihirapang huminga yung pasyente kasi yung heart natin na pag may fluid doon sa space na yon, hindi makakapagkaroon ng heart contraction or muscular contraction. Hindi masyado na perform yung muscular contraction ng heart kasi nga merong space in between. So yung ginagawa doon in the ER or the hospital, kino-collect yung fluid in between that epicardium and parietal pericardium, which is very complicated kasi kailangan dun ka lang sa space kukuha ng fluid. Kaya ito minsan ultrasound guided, no? And the condition wherein there is fluid in the pericardial cavity, there is pericardial effusion. Okay? If they have pericardial effusion, your heart cannot glide freely. So there is chest pain, there is difficulty of breathing, no, there is shortness of breath. So yan yung tatandaan niyo. The space between dapat walang fluid. Okay? Okay, so let's go now to your cardiac skeleton. After knowing the walls of the heart, let's go now to the cardiac skeleton. So we have three. We have septum membranaceum, Trigona fibrosa, and Annuli fibrosi. Okay? Medyo mahirap yung mga terms, so please bear with me. Your septum membranosum is the upper fibrous part of the IV or the interventricular septum. Now, it serves as an attachment for free ends of the fibers of the cardiac muscle. So, all you need to remember is that this is the upper fibrous part. Okay? The septum membranosum. So, just an orientation, this is the septum membranosum, upper fibrous part, kasi ang lower fibrous part would be the ventricular septum. Dok, ano ibig sabihin ng septum? That divides your two ventricles. Kaya ventricular septum. Okay? If this is your right ventricle, ano kaya to? Ang sabi dito, it's an inferior vena cava. No, inferior vena cava coming from the lower part of the body. No, it goes back to the heart. This is unoxygenated. Wala pong oxygen ang blood nila. Kaya nga babalik sa heart to have it oxygenized. Okay? Para ma-oxygenated yan. This is the septum membranosum, upper fibrous part. Okay? Next, Trigona fibrosa. This is in between the arterial foramina and the atrioventricular canals. It provides support and maintain the integrity of all four orifices. Now, without this Trigona fibrosa, no, without these rings of support, these orifices would stretch and the valves would be unable to function properly. So, ano itsura ng Trigona fibrosa? Sabi dito, this is the four valves, the aortic, bicuspid, tricuspid valve. So, pag valve ang pinag-uusapan, Trigona fibrosa will provide support and it maintains the integrity. So, without this, nakastretch lang ang mga valves. Pero ang valves kasi dapat, they regulate the flow of the blood in your heart. So, without Trigona fibrosa, magkakaroon ka ng dampening of the blood in the heart. So, magkakaroon ka ulit ng congestive heart failure. Hindi na masyadong makapag-contract ng maayos ang heart. Nagko-contract siya, tumitibok ang puso mo, pero nadadampen na ng sobra-sobrang heart without this Trigona fibrosa. So, kailangan din ng support that will coming from the Trigona fibrosa. Okay? So, again, these are the Trigona fibrosa, yung valve in between these ventricles or atrium or chambers of the heart, that is our Trigona fibrosa. Okay? And lastly, your Annuli fibrosi is a fibrous ring. No? It serves as the principal attachment of all muscular fibers of your atrium, your ventricles, and your atrioventricular valve. Actually, this is the main portion of the cardiac skeleton. No? There are dense connective tissue that surround the openings of the four orifices, and the strongest of its ring is the aortic ring. Why? The aorta will be having the greatest pressure from the heart, no? Kasi sila ang flow ng blood coming from the heart to the different organs. So, dapat siya ang pinaka-strongest. Okay? So, iyan ang tatandaan the three cardiac skeleton. Okay. So, after talking about the cardiac skeleton, ano pa ba? The walls of the heart, let's go to the conducting system. Yung na-mention ko kanina. The SA node is the main pacemaker of the heart, which is found at the sulcus terminalis area. Okay? The AV node, so from the SA node, it goes to your AV node. They are found at below the posterior lip of the aortic valve. Your bundle of His, that is the trigonofibrosum dextrum, that is continuous with the smooth muscles. And after the bundle of His, it goes to the right or left branches, and it goes to your Purkinje fibers, which is a modified cardiac muscle cell. And that is the function of the Purkinje fibers is conduction, no, for impulse conduction or part of the conducting system. Okay, it's not Purkinje cells, ha. Purkinje cells are found at the brain. So this midterms din yan, you'll be encountering Purkinje cells. But in the heart, It's Purkinje fibers. And again, where can you find Purkinje fibers? You may find it at the subendocardium. Okay? Yeah. So this is just a picture that I've shown you a while ago from the sinusoidal node or SA node, the main pacemaker of the heart. It goes to our AV node, bundle of His. It goes to the left branch and at the right branch and the Purkinje fibers. Sorry, it's Purkinje fibers, not Purkinje cells. Now please correct this illustration. It's Purkinje fibers. Thank you. Okay, so after the heart, let's go to your blood vessels. So, blood vessels are tubular structures that convey blood away and towards the heart. So, kapag away from the heart, pag away, arteries. Towards the heart or papunta sa heart, it's the vein. Okay? So, the arteries is, they convey blood towards the organ and tissues from the heart, and the vein is returning blood coming from the organs to the heart. Okay? But at this point, alam nyo na yung difference ng arteries and the vein. Because after this slide, we'll be talking on the histologic characteristic of arteries, capillaries, and veins. Okay? Yeah. So, we have classification, not just arteries and vein. For example, an artery, we have elastic artery or the large arteries. The muscular artery, on the other hand, we have the medium-sized artery or the muscular artery. And you have arteriole. And the yung single layer is the capillary. We also have at the vein, you have large veins, medium-sized veins, and a venule. So each and every classification of arteries and the veins will be taught to you in the next slides. Okay? So at this point, no, as a medical laboratory science student, alam nyo dapat na merong arteries and veins. And for the arteries, we have different types of artery depending on the diameter and depending on the function of each. Okay? Alright, so we have three layers of blood vessels, namely your tunica intima, your tunica media, and your tunica adventitia. Okay? Let's start with from inside to outside. So, intima, bakit intima? Because they are intimately related to the blood. No? Sila lang yung nagtatouch ng blood. Kaya intimate sila. Kaya intima. They are lined by a single layer of endothelial cells. That's the endothelium. And the subendothelial layer of the tunica intima is just a loose connective tissue. Okay? We will be also talking about internal elastic membrane, pero mas magandang i-explain to with a picture. So mamaya natin yan. I-discuss natin. Next is the tunica media. So this is circumferentially arranged smooth muscles with elastic fibers, collagen fibers, and proteoglycans. So if your internal elastic membrane separates your tunica intima to tunica media, your external elastic membrane, on the other hand, will be separating your tunica media from this one, your tunica adventitia. Look, pag external, separating media and adventitia. Kapag internal, separating your intima to your media. Okay? Mamaya papakita natin yung pictures. And last layer of the blood vessel, this is the outermost layer. It is composed of a loose connective tissue. And at this layer of the blood vessel, it is actually composed of collagen fibers, elastic fibers, blood vessels, and nerves. Alright, so this is the general classification of your blood vessel, general layers. No? Look at this one. This is the intima. Kasi nga, nandun siya sa comes in contact with the blood. The endothelial layer, your subendothelial layer, kahit sa veins meron, and the internal elastic lamina separating your tunica intima to your tunica media. Okay? And your external elastic lamina or external elastic membrane will be separating your tunica media to tunica adventitia. Okay? So in here, so from the arteries, it goes to your anastomosing network capillaries. Okay? Anong ibig sabihin nito? This is where the exchange of oxygen will come through the capillaries. So, single layer lang yan of endothelial cells. So, ibig sabihin, one layer lang dapat. No? Whereas here, in this picture, look class, ano mapapansin niyo? Can you give me one difference of an artery and vein based on this picture? Number one, it's the lumen. Look at the lumen of the artery. It is smaller compared to your larger lumen. What else? Look at the the layer of the blood vessel. The tunica media of your artery is thicker compared to your tunica adventitia or externa. Okay? Whereas here, your tunica externa or tunica adventitia in the veins is thicker compared to your tunica media. Okay, those are two differences. The lumen and the thicker tunica media on the artery and thicker tunica adventitia in the veins. What else? Presence of valves sa vein. Wala pong valves sa artery. Okay? So, in short, sino kaya mas malakas or mataas na pressure? Yung artery or yung vein? Obviously,
Artery.
the artery, no? Ang lagi kong in-example dyan, class, yung host ninyo, no? Pag if ever naglaro kayo sa garden or sa parking na gusto niyo mag-car wash or magdilig, anong ginagawa niyo para mas mataas yung pressure? 'Di ba tinatakpan ninyo yung host ninyo? No, ngayon kasi mas social na, may mga nabibili ng mga depindot na lang na hose, no? May depende sa anong gusto niyo yung pressure. Pero tanggalin niyo 'yon, just the hose, no? Pag gusto niyo na mas mataas na pressure, nililiitan ninyo yung diameter. So kapag mas maliit ang diameter, mas malakas yung pressure compared to this larger diameter. Okay? So that would be the blood vessels, the artery, the veins, and the capillaries. Okay, Doc, what are the Vasa vasorum and Nervi vasorum? So, mga terms to. The Vasa vasorum is a blood supply of a blood vessel. No? It is a vessel within a vessel. So, may supply din pala ang blood vessel. Ang blood vessel nagsusupply sa mga different organs. So, this is what we call your vasa vasorum. So, anong itsura niyan? Your vasa vasorum usually found at the tunica adventitia. Andito po siya. Okay? Now, this one is your vasa vasorum. No? Bakit? No, may mga blood sa loob at it has lumen. Okay, these are your vasa vasorum. Right? So, what else? We have, asan ba yan? Tunica adventitia. Okay, if this is the tunica adventitia, it is composed of fat, no, adipose. Makikita ninyo, this is a structure na may lumen sa loob, no? Hindi niyo natin ayun, these are the blood. This is the lumen. So this is your vasa vasorum. So usually they are found at the tunica adventitia. Okay? If there's a blood supply of a blood vessel, we also have nerve supply of a blood vessel, and we call that your Nervi vasorum. No? Anong itsura niya? This one. Hindi masyadong maganda, medyo blurred, but the Nervi vasorum is composed of nucleus inside, no? wala siyang lumen at usually kasama siya ng blood vessel. Ay, actually, meron dito. This one is a Vasa vasorum dahil may lumen. And this is a Nervi vasorum, which is a nerve supply of a blood vessel. Okay? Madaling tandaan. Nerve is the nerve supply. Vasorum is a blood vessel. So, they're both found at the tunica adventitia. Okay, so let's start first with the arteries. Okay? Again, what does it carry? Oxygenated or non-oxygenated?
Oxygenated.
Oxygenated. Very good. So, just like the veins, they have three walls. You have tunica intima. The tunica media in an artery is the thickest coat or the thickest layer. And you have the tunica adventitia. Okay, let's start with the large arteries. Your large arteries is also known as your conducting arteries or elastic arteries. No, the tunica intima of your large arteries, no, they are tall. They have tall, round, or polygonal endothelial cells. But take note at the large arteries, they don't have hindi prominent yung internal elastic membrane nila. No, what again is the internal elastic membrane? That is the separation between tunica intima and tunica media. Okay? So again, generally speaking, large arteries or arteries in general, the thickest coat is the tunica media. Now, the tunica adventitia is comprised of loose connective tissue, your collagen and elastic fibers, blood vessels, nerves, and ano ba yung VV na yan? Oh, sorry, about type area. It's not VV. Ayan. So, this is the artery. No? Alam na alam nyo na class that this is an artery. Why? Because from this tip of the pointer, from this tip of the pointer up to this area is your anong coat to class? Anong layer ng blood vessel? Yan. Ano to? Tunica? Class? Anong layer to? Tunica?
Media.
No? Nakita nyo kung gaano kakapal? So, ang clue nyo is the thickest layer. So, this is the media. Okay? So, these are the small blood vessels. No? Meron siyang mga lumen at blood sa loob. I think, this is the Nervi vasorum. This is kapag may lumen, these are our Vasa vasorum. Okay? So, in the tunica media, it is composed of smooth muscles and elastic fibers. Okay? Alright, so another picture of your large arteries. Now, look. If this is your tunica intima, here, from this tip of the pointer up to this here, the structure that separates your tunica intima to tunica media here is the internal elastic lamina. Sabi natin, not prominent. Pero class, there are present. Okay? There are present internal elastic lamina pero not prominent in the large arteries. Okay? Kasi, in the medium-sized artery, very prominent ang internal elastic membrane or internal elastic lamina. The medium-sized arteries are also known as your muscular arteries or your distributing arteries. Class, gusto niyo ng kung paano kabisaduhin to? MMDA. Okay? Medium-sized arteries are muscular or distributing arteries. MMDA. Okay? Now, the tunica intima, it's also just like large arteries composed of squamous endothelial cells with collagen and elastic fibers and very prominent internal elastic membrane. Look ko, the tunica media is composed of 25 to 40 layers of circumferentially arranged smooth muscles. So, ano itsura niyan? Here. Usually, class, if there's a medium-sized artery, there is also medium-sized vein. Okay? I've already said the differences. Look at the lumen of your medium-sized artery. It's smaller compared to the collapsed, larger lumen of the medium-sized vein. Okay? Now, look at the tunica media here and the tunica media in the medium-sized artery. No? Obviously, you have a thicker tunica media in the medium-sized artery and you have thicker tunica adventitia, no? Sa labas ng medium-sized vein. Okay? Yan. So, alam niyo na that this is an artery, no? Just by looking at it kasi malaki ang tunica media niya. Now, look at this one class, no? This is the internal elastic lamina. Kitang-kita mo yung separation ng tunica media, no? Nakita mo yung crooked na yan. Sa laboratory, mas ma-appreciate nyo kasi it's black, no? The stain siya as black. So, in the practical exam, we will be using the one that is posted in your Moodle in the laboratory orientation. So, the one that is, yan, ginawa ko rin, this is the internal elastic lamina, very prominent in medium-sized arteries. Okay? And not lastly, small arteries. They are similar to medium-sized, pero ang average diameter nila is 300 micrometers lang. What is the difference between the medium-sized and small arteries? IEM, or the internal elastic membrane, is not prominent as well. But they are present. Okay? Ano itsura ng small arteries? Yan. So this is a small arteries. E are your endothelial cells. M here signifies your tunica media. So maliit siya, pero it is characterized as small arteries. Okay? Now, if you look closely, the small arteries, the average diameter is 300 micrometer. Look at the arteriole. The average diameter is 100 micrometer. Paliit ng paliit. So, wala naman masyadong pinagkaiba. Ang small artery sa arteriole, yung diameter lang yung class. Okay? Please take note, ha? Look at the tunica media also. The tunica media of the arteriole, it only contains single layer of smooth muscle. Okay? Single layer of smooth muscle. Paliit na paliit hanggang maging capillary siya. Okay? Yan. Mas maliit na to sa small artery. There are arterioles. But malaman na arterioles, may smaller ang lumen, thicker ang tunica media. That's your clue. Okay? Now, look at this one. If this is an arteriole, because it is composed of a smaller lumen and bigger tunica media, ano kaya itong C na to? After the arteriole, this 100 micrometer, C here signifies your capillary. No? Ang liit-liit. No? So, let's go now to your precapillary pala muna. Before the capillary. Your precapillaries is also known as your meta-arterioles. So, look, paliit na napaliit. Diameter is 50 micrometer. And this is the transition from the arteriole to your capillaries na. Okay? Just like your arteriole, unlike your arteriole na may IEM pa rin pero not prominent, in the precapillaries, they don't contain IEM or internal elastic membrane. Wala na silang internal elastic membrane kasi ang liliit na masyado. Hindi mo na ma-distinguish yung intima sa media kasi pa-transition na sila from arteriole to capillary. And they are called your precapillaries or your meta-arterioles. And that's it. Welcome to your capillaries. There are thin-walled tubes which branch extensively. The diameter is 5 to 10 micrometer. And its length will not be exceeding more than 50 micrometer. Perfect definition of your capillaries is it contains a single layer of endothelial cells on a basement membrane. Now, question. Kaya ba pumasok ng RBC sa capillaries? Yes or no?
Yes po.
Why? Ano bang diameter ng RBC? No, based sa lecture ko last week, dun sa video. What is the normal diameter of a red blood cell? It's 7.5 micrometer. Kaya ba siyang pumasok sa 5 to 10 micrometer na capillaries? Yes or no?
Yeah.
Very good. Yes, pero single layer lang siya. Okay? Hindi siya katulad ng parang stampede sa arteries and sa large and medium sized artery, no, na marami. Pero dito sa capillaries, isa-isa lang ang pasok sa capillaries kasi ang diameter niya is 5 to 10, enough for a 7.5 micrometer red blood cells. Okay? So this one is the arteriole. So the meta-arteriole or your precapillaries, that is the transition from an artery to your capillaries. So it goes to your precapillary sphincters. These are endothelial cells. The true capillary here is the single layer. So from the arteriole goes to your true capillaries. No, magkakaroon pa ng maraming channels going to your endothelial, going to your post-capillary venules na. Then this is the venous end. There is the exchange of oxygen happening here at the true capillaries. So from the arteries, goes to your capillary, exchange of oxygen, no, kuha, and then goes to your venous end. Wala ng oxygen. Ano mangyayari dito? The venous end, it will go back to the blood. Pero dadaan pa siya sa post-capillary venule, small vein, medium-sized vein, large vein, into your heart. Okay? Microvasculature. So this is the composition of your microvasculature. Arteriole, meta-arteriole, your precapillary sphincters, your true capillaries, the one that I mentioned kanina, your thoroughfare channel, it goes to your post-capillary venule. And it will go back to your heart. Clear? No, understood? The microvasculature. Kaya pala may exchange of oxygen happening at the true capillaries. For example, this is a liver or kidneys or any other organs, no? Supplying the kidneys, it will go here and the blood here will coming back or will returning back to the heart for oxygenation. Okay? All right, so let's go now to the different types of capillaries. Okay? Your endothelium, no, that is uninterrupted is your continuous type of capillary. No, they lack pores in the wall and they are usually found in the muscles, nerves, and connective tissue. Okay, wala siyang pores. Look at the continuous type of capillaries here. No? Yun si RBC, mag-isa. Kasi nga, 5 to 10 micrometer lang yung diameter ng blood vessel na capillary. So, isa lang siya. Isa-isa yan, si RBC. No? These are pinocytic vesicles, hindi yan yung pores. Tapos, this is an example of a continuous type of capillary. Actually, they are found, number 1, at the skeletal muscle. And in the capillaries, continuous type of capillaries are found in the nerves, specifically at the gray matter of the spinal cord. No? Kasama ng mga neurons ang continuous type of capillary. Mamaya papakita natin yan sa laboratory. No? So again, continuous type of capillary, the endothelium is uninterrupted. Okay, next. The fenestrated type of capillaries. Okay? May tatlo yan. No, the fenestrated with diaphragm, fenestrated without diaphragm. Okay? So, in this picture, actually, dalawa to eh. Saan yan? Yan, fenestrated with diaphragm. So, the endothelium here contains pores of 80 to 100 micrometer that is closed by a very thin porous diaphragm. Okay? Naka-close yan. Pancreas, GIT, cord, plexus, ciliary body, these are the example of your fenestrated with diaphragm. Naka-close. No? Pero, When we say fenestrated type of capillary without diaphragm, pores are not closed. Why? Because the perfect example for a fenestrated type of capillary is the glomerulus. Would you imagine, ang function ng glomerulus is to filter, right? Is to filter blood. If ever ang pores mo hindi nakasara, hindi makapag-perform na maayos ang renal glomerulus. And its function is for filtration. No? Pag kinlose mo yan, baliwala ang renal glomerulus. Okay? So, ibig sabihin, fenestrated type of capillary ang renal glomerulus or the kidneys, no? And they are fenestrated without diaphragm. Take note at the practical exam or at the theoretical exam, don't just answer fenestrated type of capillary. I will be mentioning with diaphragm or without diaphragm. Okay? So, pag without diaphragm, automatic, it's renal glomerulus so that it can function as filtration. About sinusoidal fenestrated, they are wider lumen, larger fenestration, and they lack diaphragm. So, don't just answer without diaphragm. They are sinusoidal. Okay? And the last is the sinusoidal capillaries. So the endothelium here, they are lined of a relatively large caliber and irregular cross-sectional outline. They're tortuous packed. They are greatly enlarged diameter. They are discontinuous. So if you have continuous type of capillary, your sinusoidal is also known as your discontinuous type of capillary or your sinusoidal. They have discontinuous basal lamina and lining. Look, no? Hindi siya continuous, unlike the continuous type of capillary found in the skeletal muscles. So the sinusoidal type of capillary are found at the liver, bone marrow, and some endocrine glands. Okay? Sinusoids can also be found at the spleen. Okay? Saan pa ba? Liver, yan. Liver, bone marrow, spleen, sinusoidal capillaries. Tandaan nyo lang dyan is the discontinuous type. Okay? Sinusoidal capillary. Ayan. So, this is actually what organ class. Sige nga. Is one of my favorite sections, 2 MTP. Yeah, what is this organ?
Liver po.
Very good. Liver, because of its mononucleated or binucleated nucleus, and the arrangement is rows or cords or column. So the sinusoidal capillaries here are this one. The spaces are the sinusoids. Hepatic sinusoids ang tawag kasi nasa liver siya. So they are found in between the hepatocytes. So these are your sinusoidal capillaries. Also this one. All the spaces na maliliit, no, those are your sinusoidal. So, it's not continuous type. No? Kung makita ninyo, putol-putol, tsaka they are discontinuous. So, those are your sinusoidal capillaries. And lastly, are your sinuses. Okay? Endothelial cells. Yung sinusoids are found at the liver. Your sinuses are found at the spleen pala. Okay? The endothelial cells at the sinuses are elongated along longitudinal axis of vessels and are surrounded by reticular fibers. So specialized vessels are found at the spleen. They are categorized as sinuses. Okay? Not sinusoid. Sinuses. Ayan. So this is the spleen. Next week, our topic will be lymphatic system. So this is the white pulp and this is the red pulp. In the red pulp, you will be seeing this sinuses. Okay? Not sinusoid. Okay? Correct me. Sinusoids are found at the liver, bone marrow, yan, and some endocrine glands. Sinuses are found at the spleen. Specifically at the red pulp. No, red pulp. This is the white pulp. This is the red pulp. Ayan. So if this is the spleen, if you see any spaces in between this one, these are all your splenic sinuses. Okay? Splenic sinuses. Okay, so we're done with the arteries. We're done with the capillaries. Let's bring back the blood to our heart. So, paano natin gagawin? The veins. So, the veins, larger ang caliber. They have thinner walls than arteries, pero the thickest coat of the vein is the tunica adventitia. Okay? Also, tunica intima is an endothelial layer with thin subendothelium. Your tunica media is composed of smooth muscles with fibers, elastic fibers. But the tunica adventitia, it is in large amount of collagenous connective tissue. Kaya siya ang pinaka makapal with Vasa vasorum and Nervi vasorum sa veins. Okay, let's start with the venule. So from the capillaries, punta muna tayo sa venule bago tayo pumunta sa heart. Now, in this venule, tunica media is very indistinct. Now, it has an incomplete layer of smooth muscle. Now, look at the tunica adventitia. In the venules, it is only the prominent coat at the venule. And the example of a venule is the central vein of the spinal cord. Okay? The central vein of the spinal cord. No, in the prelims, we've oriented you your the gray matter and white matter. No, in the butterfly shape, gray matter. Sa gitna talaga nun is the central vein. So this is an example of a venule. Okay? Ayan. So if this is an arteriole, this is the venule. No, mas malaki ang lumen, mas larger ang tunica adventitia, whereas here, larger ang tunica media ng arteriole, and this is no cute capillary na single layer of endothelial cells. Okay, let's go now to your small veins. Just like any other blood vessel, it has three coat, your tunica intima, your tunica media, and tunica adventitia. Example of a small vein is the trabecular vein of the spleen. Okay, that is an example of a small vein, trabecular vein of your spleen. If there is small artery, you also have small vein. Pero look, there also has larger ang lumen compared to your smaller lumen in the arteries. In-emphasize lang dito yung tunica media ng small arteries. Now look, ano kaya to class? Present sa vein. Ano kaya yung, if you're listening to my differentiation between vein and arteries, what is this structure that is only found in the vein?
Valves.
Valve.
Good. No? Valves. Those are valves na nakikita lang sa veins. Very good. And let's go to your medium-sized vein. Most of the veins in the human body is composed of a medium-sized vein. Your tunica intima is the same, thin layer between endothelium and subendothelium. Your tunica media is composed of circular arranged smooth muscles with collagen and elastic fibers. Okay? But your tunica adventitia is the well-developed tunica in the medium-sized vein, and it forms the bulk. It also contains your collagen and elastic fibers. All veins of the visceral organs are considered as medium-sized veins. Tandaan nyo yan, ha? Veins of all visceral organs are considered medium-sized veins. Yan. So, if there is medium-sized artery, usually katapat niya or katabi niya si medium-sized vein. No? Nakita niyo yung lumen class, it's collapsed. Unlike here na artery, very good ang pagkakabilog niya. And look at the tunica media. Thicker compared to your thicker tunica adventitia in the medium-sized vein. Okay? Where can you find medium-sized vein? Veins of the visceral organs. Okay? And lastly, your large veins. No? Kaya question mark ito kasi There has been books saying that the IEM is prominent in the veins, but hindi natin masasabi. Even Jonquera hindi pa masyadong nasasabi na there is an IEM between intima and media. For the large veins, it's poorly developed ang tunica media niya. It is composed of a thin, smooth muscles with few elastic fibers. Now look at the tunica adventitia, greater part. That it is composed of loose connective tissue, collagen, and elastic fibers. The large veins example are the following. Sige nga, can you supply what are the meaning of SVC, IVC, SMV? What is SVC? Anyone? Superior vena cava. IVC?
Inferior vena cava.
Very good. SMV. Superior mesenteric vessels and the renal vein. These four are example of large veins. The rest are medium-sized veins. Okay? Again, example of large veins are your superior vena cava, your inferior vena cava, your superior mesenteric vein, and the renal vein. Okay? Okay, this is just a differentiation between an artery and a vein. Now look at the lumen. It has a smaller ang lumen ng artery, bigger ang vein. The thickness of the wall, of course, thicker ang tunica media ng the thickest coat in an artery is the tunica media. The thickest coat in the vein is tunica adventitia. The thickness of the wall, wall pala, thicker ang artery compared to your thinner vein. The rigidity, more rigid of course ang artery compared to your less rigid vein. The internal elastic membrane present sa artery, absent sa vein. The muscular elastic tissue, more abundant of course in an artery, but the muscle elastic tissue prominent only sa vein at the large veins. Okay? Valves, present in veins of the medium-sized caliber but absent sa artery. What else? The tunica intima appears scalloped after death, pero ang vein never nagiging scalloped after death. What else? Vasa vasorum. The vasa vasorum, look, they extend up to tunica media sa artery, pero ang extension of the vasa vasorum ang vasa vasorum will extend up to tunica intima kasi nga yung tunica adventitia mas makapal compare it to your artery, sa vein. Okay? All right. Thank you for listening.